Hello everyone and welcome to FAIR's free monthly webinar series. My name is Carrie Molkowski, National Programs Manager at FAIR and your moderator for today's presentation, Advocacy 101, How to Influence Policies and Improve Lives. Just a little bit of housekeeping before we get started today. This presentation will be recorded and posted on the FAIR website in about 7 to 10 days. Please note that for maintaining a quality recording, all attendees will be muted throughout the webinar. However, you can submit questions throughout this broadcast by using both the questions and chat features in the GoToWebinar toolbar that you'll see along the right-hand side of your screen. If time permits, at the end of the presentation, we will respond to some moderated questions for our presenters. For those of you on Twitter, we encourage you to join us in conversation during the broadcast. You can follow along with our webinar live tweets at our handle @foodallergy or #FairWebinar. Today's session will provide some basic ideas of how to influence and change policies that affect the food allergy community. You will also learn about resources that are available to you from FAIR to take your message to legislators. At the end of the presentation, you will have the opportunity to ask questions of FAIR's advocacy team. So with us today are two of FAIR's advocacy team members, Jennifer Jobrack and John Hoffman. Jen Jobrack is the Senior National Director of Advocacy for FAIR. She manages the state, municipal, and industry-specific policy portfolio focused on the inclusion and safety of people with food allergies. Recent campaigns include access to epinephrine in schools, public places, and airplanes, college and university preparedness for students with food allergies, restaurant accommodations, food labeling, and improving the emergency treatment of anaphylaxis. Jen works with national coalitions of advocates, public officials, and industry leaders on best practices in legislation, strategy, and implementation. We also have with us today John Hoffman. John joined the FAIR team in August 2016 as the Associate Director of Advocacy. He brings 4 years of experience in the digital advocacy realm, leading campaigns and utilizing new media to motivate and direct advocates to make their voices heard with legislators and regulators. He is working to expand FAIR's online capabilities and enhancing the tools advocates will use to share their stories and encourage the passage of new legislation. At this time, I'm delighted to turn the presentation over to them.
Thank you so much, Carrie. I'm delighted to be on this call today with everyone. I am based in our Chicago area office, but the work of FAIR is nationwide and is made possible through many advocates, too many to count. But we can't do the work we do on improving safety for people with food allergies without the tireless dedication of literally thousands of people across the country who have gotten involved and led many important efforts, which we'll talk about today. So I'm also a food allergy mom. So this is an area of work that is very important to me personally, and I've been with FAIR and one of its predecessor organizations for nearly 7 years. I want to take a few minutes, and for some of you on the call, this may be old news, but it's always good to have a level set and make sure we have a shared understanding of the scope of the issues we're trying to address. So you've probably all heard that our estimate is that there are 15 million Americans living today with food allergies, and that includes approximately 6 million children. This is a number that has been growing in recent years, and we have every reason to believe that the next time we try to ascertain that number in a statistically valid way, that we'll see an increase in that number, but that's the number that we're working with today. Next slide, please. Putting it in perspective, if we counted everybody up with food allergies, and if it were a state, it would be the 5th largest state in the U.S. after California, Texas, New York, and Florida. And if you combine the populations of New York, LA, and Chicago, the number of people with food allergies in the U.S. is greater than those populations combined. Next slide, please. And this is an important statistic when we're talking to legislators, many of whom have no idea of the scope and size of the population that's affected. The purpose of today's session is to talk about advocacy, what you can do to influence public policy, to improve lives of people that you know who are living with food allergy, whether it's yourself or a child or another family member or beloved person in your life, as well as the broader community. Many people who live with food allergy find that once they've begun to master how to manage the life of the person that they're taking care of, they want to turn that energy to something outward and maybe make a change that affects more people. And that's really what the emphasis of the talk here is today. But maybe you're already doing things that are advocacy activities. You don't even think about it. If you've ever created a 504 plan for your child at school, if you've distributed your food allergy action plan and educated your babysitter or a family member about how to buy food and serve food safely, how to use epinephrine in the event of an emergency. These are advocacy activities. Maybe you're an adult with food allergies and you've trained your workplace on the use of epinephrine auto-injectors, and you live in a state where they are permitted in workplaces and you've encouraged your workplace to get them. That's an advocacy activity. Maybe you've met with your school on developing a food allergy policy, or you attended a school board meeting where you've talked about allergy issues as a matter of public concern. These are all advocacy activities. Next slide, please. But let's say you encounter an issue that you feel is not adequately addressed presently, and you decide maybe there should be someone paying attention to this in the public policy realm. A good example of this is the history of the recent history of the movement to put epinephrine auto-injectors in schools. This movement started with, unfortunately, some very difficult situations, including fatalities of people who were children who were at school who suffered allergic reactions and for whatever reason did not have prescribed epinephrine. And the big idea that many states embraced was, let's move epinephrine into the school building, even for kids without a prior diagnosis, so that we can prevent catastrophic outcomes in the future. But you might have a big idea of your own that you want to see enacted. Next slide, please. So one thing you need to think about is, what's the issue you're trying to address? Are you trying to bring a food allergy policy into your school? Are you trying to change the practices of a favorite restaurant or a restaurant that you would like to be a favorite? Is your question solved by a law? Is it a regulation? Is it a change in policy? Here's an important question. Does the law or the regulation or policy already exist? I can't tell you how many times we get calls at FAIR from folks who very much want to see change on an issue in their community, and they think that the issue needs to be solved by enacting a law, when in fact the law has already been passed, and the entity in question, be it a school or a restaurant or a daycare center or what have you, may not be in compliance with that law. So you first need to understand whether what you're trying to do is handled statutorily, regulatorily, or just by talking to the people in charge and getting them to change policy. And if your idea has already been tried, why didn't it work before? What's going to be different this time? We can talk more about that in a little bit. Next slide, please. Again, this is about doing your homework. Who are the key players in what you're trying to do? If you want, let's say, labels to be changed on manufactured food, which is an issue that FAIR continues to work on, that's handled by the federal government. That's not a state issue. If you want your airline carriers to practice better policies with respect to inclusion of people with food allergies, going to your state senator isn't really going to do much, but going to your United States senator might be a different story. It's really understanding where the influence is, where the jurisdiction is, and where your efforts are best put. And you can achieve your objective by doing a lot of things before you consider legislation. Have conversations with people in the know. Do your research. Every single jurisdiction, whether it's your city, your state, or the U.S. government, has online resources to look up laws with search terms like epinephrine, search terms like accommodation, etc. And these are, it's much easier today than it ever has been. You can also consider FAIR a resource. We are happy to let you know, and we have information online about states, the status of various laws in different states, some of which we'll show you shortly. You can find people who share a similar opinion as yours and want to organize together, write letters to the editor, implement a policy or training perhaps in your school using FAIR resources, and then hold people accountable. When laws get passed and signed into law, make sure that you know who's responsible for implementing and enforcing, and hold them accountable. Call them, meet with them. You're a constituent, you're a voter, you're a taxpayer, you have a right to know. Next slide, please. So let's take an example. This is with respect to stock epinephrine. We have 49 states now that either have may or shall stock laws on the books. That means that the state either requires or permits schools to stock epinephrine. In addition, we have 30 states that permit other kinds of entities to stock epinephrine. That could be a daycare center, a summer camp, an auditorium, a workplace, a restaurant. But in most instances, these are not required laws, which means that now that the practice is permitted in the state, but there still needs to be work done to get that school, to get that entity to understand the importance of stocking and make the decision to do so. Hawaii is the one state that does not have a stock epinephrine law on the books. So if your school does not stock epinephrine, why does it not? This might be an important question that you can ask. Does it not know about the law? Does it not know that it's permitted to do so or that it's required to do so? Has it made a decision not to do so? And they've discussed it and decided against it, and if so, why? Do they interpret the law incorrectly? Do they think that is there some reason that they maybe mistakenly understand what the liability protections are, or similar issues? And then it's really a question of asking yourself, is a new law necessary here? If my school is not stocking epi, if my child's day camp is not stocking epi, and I think they should, it's really a matter of getting a law passed, or is it doing some work to explain to them and convince them and get their buy-in to do so? Next slide, please. So this is a little hard to read, at least on my screen, but this gives you a sense of the dark blue are the states that require schools to stock epinephrine. The turquoise are states that permit schools to stock epinephrine. And if you live in a state that is dark blue, your school, and I should be specific, your public school, although in some cases it does apply to private school, but for purposes of right now, if your child attends a public school in one of these states, your school should be stocking epinephrine. If they're not, they are likely not in compliance with the law. There are a few specific exemptions in some cases, but By and large, the vast majority of schools should be in compliance by stocking epinephrine. So if you have an issue with your school not stocking it, then that's a matter of being out of compliance with the law. If the legislation in your state permits schools to stock, that's the turquoise, then if they choose not to stock, they're not out of compliance. They've just made the decision to not opt in. So if you want your school to stock and you live in one of the turquoise states, you're doing different work than you would be if a school were not complying with a law. Next slide, please. This is a different map that shows the public entity laws. So these are laws that allow entities across your state to stock epinephrine autoinjectors. This is just one example, by the way. This is not intended to be an entire webinar on epinephrine access, but this is an example. So if you live in a state that is dark green here and you want your favorite summer camp to stock epinephrine, they are totally permitted to do so, and there is indemnification, so there's no liability considerations, and they can go ahead and do it, and you're convincing them perhaps to do so. And if you live in a gray state, well, some people have asked, does that mean that my camp can't stock epi? And that's not necessarily the case. They may be able still to do so, but there aren't the liability protections that there are in the laws that are currently in place. So in that case, you may have to work with legislators to get bills passed. And there are a few of these gray states where there is legislation pending. Next slide, please. This is another slide. This shows states that are on the right. Let me take the right side first. These are places where there are laws in place pertaining to food allergy training of restaurants. And in those 5 states that you're seeing, Maryland, Michigan, Rhode Island, Virginia, and Massachusetts, those states require their restaurants to undergo some food allergy safety training. Now, there are details that vary from one to the next, and there are going to be some states that have exemptions for, let's say, large chains or other considerations. But by and large, if you live in one of those states and the restaurant that you attend, there should be at least one person on staff who has undergone authorized food allergy safety training. If they can't convey that to you, if they haven't done it and they're not exempt, then they would likely be out of compliance with law. On the left, just as another example, these are. Oh, and let me say one more thing about the table on the right. New York City and St. Paul, Minnesota, they have poster laws. So those are places where the restaurants are required to display food allergy awareness posters, but those are not the same as food allergy safety training requirements, but they are restaurant poster requirements. The table on the left, Indiana, New Hampshire, and New Jersey, these are 3 states that, independent of any other efforts, have passed laws allowing but not requiring the college campuses in those states to stock epinephrine. So if your child or you attend a college or university, or you work at one in one of these states, that is a permitted but not required practice. These are all campaigns and efforts, many of which FAIR has been involved with, and certainly many advocates as well. Next slide, please. This just gives you an idea of some of the bills that were signed in 2017. And the intention here is not to go through each one, but it's really to give you a sense that, and this webinar will be online, I understand, in a few days. The point of this slide is to convey that there's a lot of activity legislatively pertaining to issues that affect the food allergy community. They can be specific to auto-injectors and who can use them and under what circumstances. They can be related to asthma, which is an issue of obviously that a lot of folks with food allergies are affected by. They can be broader issues pertaining to record keeping for medicine and school nurse issues and the like. This is about doing your homework. Before you say there ought to be a law, there ought to be something that the legislature does, one of the things you have to do, and again, FAIR can be helpful, and there's also a lot of information on state legislative websites, is to know what laws are already in place, who's responsible for enforcing them, when do they go into effect, and what are the consequences if they don't. Next slide, please. So
I'll take it from here, Jen. Thank you.
Yeah, thank you, John. Sorry.
Yeah, no, it's okay. Thanks, Jen. So as Jen sort of alluded to, based on the size of our advocacy team, you're talking to the totality of the advocacy team today. We need to make sure that our advocates are empowered to lead and bring together other volunteers and local organizations to conduct these state legislative efforts. FAIR's role in this is to make sure that you have what you need in terms of information, training, and materials to succeed. After you've gone through the process of making sure the idea you had isn't already a law or just isn't being enforced, or maybe isn't something that needs to be handled with a change in regulation, you need to find a legislative champion. Your first step should be to look at laws in that state that are related to the issue you're interested in, or bills on your issue that have failed in the past, as Jen said earlier. Schedule a meeting with your own legislator to talk about why the issue is important to you, and see if they would be interested in introducing a bill, or if they know a legislator who might be interested in pursuing that bill for you. At any of these meetings, make sure you bring some data about how this issue is affecting people both in your state or nationally. And if this issue has been addressed in a law in other states, make sure you know those too. Anticipate on only having a few minutes to tell your story and make your ask. In 4 minutes, you should be able to share why this issue is important, what you think should be done about it, and ask for help or support to make it a reality. You're unlikely to get an immediate commitment from the legislator or their staff, but you should tell them to reach out to you with any questions that they might have, or ask for a timeline for when you should expect to hear a decision. Also, make sure you follow up after the meeting with an email to thank the staff that you met with, and be sure to reach out back around the time they said they would have a decision. We put together a number of toolkits on introducing legislation around restaurants in your area, advocating for undesignated stock epinephrine in your schools, and also at public entities in your community. These kits have FAQs, sample bill language, and also facts and statistics that you can use in your meetings with legislators. We believe that these toolkits, along with coordination with FAIR and the other information on our website, should give you everything you need to start a legislative campaign in your state. These are available on our website and on the advocacy page for free download. After you secured a bill sponsor for your effort, you need to expand the base of support and hopefully add more co-sponsors to the bill. You'll want to reach out to support groups and any other community-based organization that may share your views on this particular issue. One of the ways they can help is to email their legislator. Many of you have sent a letter to the legislator about any issue that's important to you. Some of you might think that no one reads these or that they don't matter, which is just not true. Letters with personal stories and plain and convincing arguments can really change the mind of legislators and their staff at all levels. Volume is the most important factor in making a difference at the federal level, but at the state level, just a few emails written by constituents can be enough to tip the scales from a no to a yes, or vice versa. So some quick tips for writing an effective email, and this is true probably in business, but very specifically in advocating for legislation. Make sure you write your email with an attention-grabbing subject line, including the bill number. You want to make sure you state up front that you're a constituent and that you would like their support on this bill. The fact that you're a constituent is probably the most powerful thing you can tell a legislator or their staff that's most likely to make them listen to you. Provide a short summary of what the bill will do and tell a personal story about how the issue has affected you or someone you know and how this legislation will address the problem. And at the end, restate the ask of support and say thank you. If you're on social media, I encourage you to post a link to the action alert you're responding to or paste the letter you've written to your legislator in the post. If people see how easy it is or can use your language as a base for writing their own email, they're much more likely to join you. Calling your legislator might take even less time than writing an email to them and can be just as effective. A couple points on that. First one, most important one, be polite and please don't yell at the staff person manning the phones. Stay calm, state your name, and again, lead up front that you're a constituent. Ask for the support on the bill that you're working on, either with a vote or signing on as a co-sponsor, depending on where the bill is in the current legislative process. And ask for a follow-up response by email. Oftentimes, they'll ask you at the end, do you want to receive an email from the legislator or a letter from the legislator telling you what their response is to your request. It always helps to do that to make sure you have on record what that legislator decided to do, how they wanted to support. So if you're given the opportunity to testify in front of a committee on behalf of your bill, or you're given the opportunity to find a medical expert or researcher to support the bill, it can be very helpful in moving your bill on to the next step in the process. First of all, you'll want to plan an agenda with the bill sponsor and know your talking points. Just like in your first meeting with a legislator, expect a very short amount of time to read your statement, and make sure to focus on your personal experience in your testimony and how the bill would make things better. If you can identify an expert to testify, that can be a big benefit. Committees often love to hear from people at the top of their field. It lends, just like your story matters and is important, expert testimony can lend just an air of higher element to the discourse. Keep it short and to the point. Practice beforehand. Know what you want to say. Know how you're going to say it. Bring props and handouts. I'm sure a lot of you have seen C-SPAN or other things where you see legislators give speeches and have giant poster boards that say or illustrate what they're talking about, why it's important. Seems kind of cheesy, but can be a very effective and helpful tool for people on the committee and people watching. And also, finally, work with FAIR ahead of time. Make sure that you are in contact with us so that we can be most helpful, providing you with up-to-date facts and statistics that will make your testimony really successful. So as you're meeting with these legislators for the first time, it can seem intimidating. As long as I've been working in advocacy, the difference in tone before and after a person's first time meeting with a legislator is always the same. Before, I always hear, I thought I had to be an expert or something to be an advocate. I assumed I'd be asked a bunch of hard questions that I wouldn't be able to make a difference. And it always turns into, this is great. These are just people like me. I got to share my story. I feel like I made a difference, and I can't wait to do it again. This may not happen, but you may be asked a question that you don't have the answer to. Don't worry. They don't expect you to have all the answers for them immediately. But the most important thing to remember is don't make something up. Try to think of some of the common questions someone who maybe isn't familiar with food allergies might ask about the bill, and have answers for those questions ready. If something gets asked that's out of your realm of expertise, let them know that you'll check with FAIR and get back to them with the answer, and try to do that within a few days of the meeting. So being an advocate means many things. It requires as much or as little as you can afford to put into it. If you remember, one thing I've talked about today, aside from don't yell at the staff when you call a legislator's office, is that advocating with FAIR is all about putting your interests and talents to bear on a policy problem. And that our job at FAIR is to find a way for you to get involved and use your talents and your personal story to make change. Do some, one, or all of these things, or do things that we haven't even thought of yet. You could write a letter, you could send an email, make a phone call, you could design handouts or do research ahead of time. You could be in charge of an email tree that helps attract more people to the cause and more people to the issue. You can share posts on Facebook or on Twitter, you can blog about it, you can write letters to the editor or call media, or you can show up during a committee meeting and either fill a seat or volunteer to testify. There's a lot of different ways to get involved, and there's a way for everyone with any sort of level of interest or knowledge level to get involved at their own comfort level. So to wrap up, we want to make sure that you're aware of the materials that FAIR has created to help you advocate for change. Our website has information about laws that have already passed and the toolkits and talking points that could help you start your own campaign. There are also handy tips that go a little more in depth than the webinar today about meetings with legislators, writing to legislators, delivering legislative testimony, attending town hall meetings, and how to form issue coalitions to help you accomplish your goals. Make sure you've signed up to be an advocate on our website, and follow us on Facebook and Twitter if you're on social media, as that'll help you hear about what FAIR is doing on a number of issues, both in the States and in Washington, D.C.
Well, wonderful. A big thanks to both Jen Jobrack and John Hoffman. This is normally the portion of the webinar presentation where we have the opportunity to answer any questions that may have come in during the presentation. So with that, we actually did get a few questions, although you guys did a great job of explaining advocacy. One of them, John, you just kind of touched on, but maybe either you or Jen could give a little bit more information. We had an attendee ask how specifically they would connect with our organization if they were interested in advocating for a specific law?
So I'll take this, Jen. You can actually, like I said, because this team is 2 people, you can email to me specifically at Hoffman, JHOFFMAN, @foodallergy.org, and we can talk about that bill and we can research together and see if that's something that we need to pursue, or maybe there's, like we said in the presentation, maybe there's a law already on the books that might address the issue.
Great, thank you. One of our listeners asked or stated, although the CDC in most states have adopted guidelines managing food allergies, many school districts still do not have comprehensive policies as encouraged by these guidelines. Can either of you recommend what is the best way to approach school districts to get their buy-in?
I'll take that. This is Jen. That's a fantastic question. So the CDC guidelines are written, the Centers for Disease Control promulgated guidelines. FAIR was one of the organizations that helped author those guidelines for best practices in managing food allergies in schools. However, there was no accompanying law that required the implementation of those guidelines at a national level. There are some states, as the questioner cites, there are some states that have passed laws requiring their schools to have, their districts I should say, at the district level, to have food allergy guidelines in place. Preferably, those would be modeled after the CDC guidelines and would be expansive and inclusive. However, what our understanding of most of those laws is that they do not, if not all, is that they do not prescribe what specifically has to be in those guidelines. That means, and I'll take Illinois as an example where I live, that you may have 100 school districts in the greater Chicago area, and a third of them may have a 3-sentence food allergy policy, right? I saw one not that long ago that says, our food allergy policy is that we will work with families to accommodate the individual needs of a student. Well, that ain't such a great food allergy policy. But the law in Illinois just says you have to have a food allergy policy. It names a couple of things that you should have in there, but it doesn't say what the language needs to be or what the policy needs to be. So what does that mean for the advocate? It means a couple of things. If you live in a state that does not have a food allergy policy requirement for its schools, then you might want to start with, first you should start with looking on our website. We have a list of the states that have food allergy policy school requirements, and you can read the statute in that state, in those states. Even if your state does not have a food allergy requirement, a policy requirement, you can still work with your school district to put one in place. They don't have to wait for the state to tell them that this is the right thing to do. The CDC guidelines embody the best practices in food allergy management in schools, things like food-free classrooms and food-free celebrations, things like emergency preparedness, and medication management and access. Things like the role of teachers' aides and school bus drivers and other folks who may not be with the student every single moment. Things like the provision of or self-carrying of medication, which is the law of the land in all 50 states. Schools are required to allow kids to self-carry. But it's about taking those guidelines, meeting with your school, whether it's your school principal or might be at the district level. That's going to vary widely from municipality to municipality, and explaining to them the importance of having best practices in place. In that case, it probably makes sense to identify other families who are living with food allergy, to meet ahead of time and agree on what are the most important things you want to come out of the conversation about a policy, to offer to help draft that policy, to use those CDC guidelines as the rubric for that policy. but also it's really important to have the buy-in of the school. And I say this to advocates and volunteers all the time. It's wonderful when parents want to lead the charge, but it has to be owned and managed by, as I always say, a grown-up in the school. There has to be a school employee, a district employee, administrator, who's going to make sure that any policy that parents bring forth gets enacted, adopted, and enforced. So I think that's really important. If you live in a state that does not have a law with a that requires the schools in that state to have a food allergy policy, like I said, you can still go to your school, but then you also might want to work with your legislator and look at some of the other language in other states that have already been adopted. The work has already been done. The policy is already modeled after CDC. It's just about requiring it. And one more thing, I know I'm giving a long answer, but if your school does have a food allergy policy and it's not really robust, that's another opportunity to get involved by working to strengthen it incrementally with other parents through your PTA, recognizing you may not get everything you want in one fell swoop, but you can begin to make some progress. And also, lastly, a food allergy policy is not a substitute for the documentation you need for your own child. So a 504 plan or a food allergy management plan, these are documents that will govern or should govern how your child's safety and inclusion are addressed. And that is the first step, is making sure that your kids' needs are being addressed, and then move on to the broader school community.
Thanks, Jen. That was an excellent answer. And I'll just reiterate that the CDC guidelines are very robust. I think they're over 100 pages, and that could be intimidating. And FAIR has worked to develop some really great, just one-page downloadable handouts highlighting some of the most important things from the guidelines, specifically for superintendents or principals or school administrators, that you could print and bring with you to the school when you request a meeting with the principal or request to be part of the team. So those are available on our website if you are interested in checking them out as well. Okay, so we have just one last question. Jenna may kick this back to you. The attendee asked, what are the top issues that FAIR is working on that I could possibly get involved in?
Well, I don't know where the attendee lives, but he or she is welcome to get in touch with us afterwards. So at the state level, we continue to look at the availability of epinephrine in public places. The map shows 30 states that already have those laws on the books. That means there are 20 that don't. There's a handful that we're working on this year. We're also always meeting with or willing to meet with regulators who are tasked with enforcing existing laws to improve them, to improve the oversight and enforcement mechanisms. So if you live in a state that has stock epinephrine in schools or public places, there's always an opportunity to work with FAIR, perhaps go meet with, as an example, your state Department of Public Health. Or if you don't live near the state capitol, to meet with a legislator to express not necessarily that you want a new law, but can you get some help in finding out how things are going? Is the law being enforced? Have there been uses of stock epinephrine in schools, as an example? So your legislator can also be a gateway into getting information you need about what's happening in your state. Other areas that FAIR is working on, some of which are not really ready for volunteer engagement, but we will always let you know. One of the big campaigns this year is on the preparedness of emergency medical services in responding to calls related to anaphylaxis. So that is a two-pronged effort. One is preparing and presenting educational information to emergency medical service professionals on what anaphylaxis is. The knowledge gaps are quite astounding, actually. What anaphylaxis is, how to treat it, how to transport the patient, etc. Once we are going to be fanning out across the emergency medical services industry and making those presentations and having those conversations. Down the road, there may be some legislative pieces of that with respect to requirements of how ambulances are to be stocked and requirements as to what emergency medical technicians are required to know, but that's a little bit in the offing. Labeling is an important issue for us. We've got work happening now with respect to expanding the Food Allergy Labeling and Consumer Protection Act, which governs the labeling of the top 8 allergens in the U.S. We're looking at expanding that to include sesame, which is a growing area of concern in terms of a prevalent food allergy, as well as some other work in labeling related to precautionary advisory labeling, which is the may contain statements that are on the bottom of packages sometimes. There's no legislative piece at this time, but there's always conversations that you can be having with your members of Congress about the importance of the FDA taking these issues on as a matter of public safety. Another issue we're working on, you may be familiar, is the complaint that we filed against American Airlines with the Department of Transportation, and this is related to denying pre-boarding for passengers with food allergy on American Airlines flights, even though passengers with other disabilities are allowed to pre-board. And when I say disability, I'm talking about a legal definition of disability, which includes food allergy, not a philosophical definition of whether people with food allergies are or not able to complete certain things. So we did file that complaint with the Department of Transportation. It's still being processed, but if you or someone you know has ever been denied pre-boarding on an American Airlines flight, and by pre-boarding I mean getting on early so you can wipe down the seat and the seat belt buckle and the tray table and all those other things, which we do with my family, then if that has ever occurred to you or to someone you love, we want to know about it. We are happy to, there's a lot of information online about other work that we're doing. We just issued a statement about the pending American Healthcare Act that is being deliberated in the Senate right now. It's important to let your senator know that if there were changes to coverage that excluded food allergy as a pre-existing condition, this would be catastrophic for our community. That we need to make sure that access to testing, diagnostics, medications, that these all are available to our community. Related to medication, I'll end here. We have not let up in our interest in and advocacy for epinephrine auto-injectors available at a reasonable price for our community, and to encourage greater competition in the auto-injector space. Some of you may have seen a new device just got approved within the last few days. And so we continue to work with members of Congress to let them know that auto-injectable epinephrine is the only medication that can stop the symptoms of anaphylaxis, and it's very important that be available, affordable and available. So whether there's a specific call to action about a bill that is pending right now, those we usually let people know. We do targeted emails that are geo-targeted, so that if your senator or member of Congress or even your state rep needs to be contacted, we let you know. If you signed up at foodallergyadvocacy.org, but there are these evergreen issues like affordability of epinephrine and food labeling that are always wise to talk to your member of Congress about, and we're happy to have those conversations with you as well.
Wonderful. Thanks, Jen. I feel like we could probably be here for several hours, if not days, talking about all of the top issues or issues that the Fair Advocacy team is working on. So again, just a huge thank you to you and John, our very small but very mighty advocacy team here at FAIR. You both provided some really great information, tips, and resources for how to influence and change policies that affect the food allergy community. So in addition to thanking our presenters today, I want to thank everybody who called in and joined us for today's webinar. As a reminder, this webinar was being recorded and will be posted online on our website in about 7 to 10 days. So thanks again to everyone. Until next time. Bye-bye.